Could Adderall indirectly be causing your hair loss? If you're looking for the answer to that question, make sure to stay tuned. Hey guys, Leon here from Hairguard.com, where people who are worried about their hair loss go to regrow their hair. If you are new to the channel and you want updating on any of the latest hair loss news or any breakthroughs that we find out about, do make sure to hit subscribe. Now, just before we get into the video on Adderall, if you're personally worried about your hair loss, then what you can do is you can click the link in the description to take the Hairguard hair loss quiz. You'll answer a few short and simple questions about yourself and your hair loss, and then you'll actually receive free expert advice on how to regrow healthy hair. But for now, let's get into the video on Adderall. Adderall is a very commonly prescribed pharmaceutical drug for the treatment of attention deficit hyperactivity disorder or ADHD. There are various side effects associated with the use of Adderall, some of which can be linked to issues of hair shedding, thinning hair, and receding hairlines. While much of the hair fall associated with Adderall may be reversible or manageable, there is the potential for more permanent damage to be caused. The use of Adderall should always be done in consultation with a physician. And guys, just a little precursor into the video, we will talk about the side effects of things like long-term Adderall use, and we will talk about how it relates to hair loss, but it's not a drug that you can just stop taking. You need to consult with your physician or doctor before you do anything with this drug. So just giving you a precursor there, but we still want to share this information with you because it can be very interesting. So first guys, what is Adderall? Well, according to the National Institutes of Health, Adderall is a pharmaceutical drug that is a combination of dextroamphetamine and amphetamine which acts as a stimulant on the body. Such drugs are currently prescribed to treat individuals with attention deficit hyperactivity disorder as well as narcolepsy. Using Adderall can help promote the ability to focus on tasks and reduce the symptoms associated with ADHD. However, it is important to note that there is limited research on the long-term effects of prolonged use of stimulants such as Adderall, and is composed of the following ingredients that you can see on the screen. Now, I'm not going to read them because some of them are pretty hard to pronounce, but you can see them on the screen there. So, what are the potential side effects of using Adderall? Well, there are numerous potential negative side effects associated with long-term use of Adderall, which is typically used for extended periods of time to treat chronic issues. There are also serious consequences to overdosing on a drug such as Adderall. The use of Adderall should only be done under the guidance of a physician, as it is a federally controlled substance and can be dangerous if taken incorrectly or if abused. Now, there are a large list of known Adderall adverse effects, but here are 7 of them which could potentially make thinning and balding worse. Number 1 is anxiety, because stress has been linked to balding. Restlessness, problems getting to sleep or staying asleep, decrease in appetite, weight loss, itchy skin, hives or rash. So what we'll do now is we're going to take a closer look at how the above may trigger thinning hair and fall. Now, the active ingredients in Adderall can have a variety of negative impacts on the body, which can in turn lead to issues of lost hair and poor hair growth. Extended use of Adderall may cause individuals to have a lack of sleep and increased levels of stress, and it may lead to skin irritation. Now, the National Institutes of Health provide a high-level review of the available literature on hair loss related to the use of pharmacological drugs such as Adderall. Now, the potential for hair fall related to drugs is variable and wide-ranging, but it can lead to noticeable shedding as well as irreversible baldness. The class of drug that Adderall fits into, as an amphetamine, is noted to be a drug that is occasionally reported to cause lost hair. The article notes that the side effects is important to recognise, as it can be a source for the lack of use compliance among patients, but can be reversible through appropriate management of the drug or complete cessation. So let's now look at how Adderall could affect the hair cycle. The British Medical Journal published a similar report on the potential for hair loss, noting that the use of a variety of drugs can interrupt the phases of hair growth early in the cycle. The anagen phase is very early in the hair cycle and may be subject to anagen effluvium, which can be caused by many classes of drugs. Included in the list of potential culprits are amphetamines, such as Adderall. However, the understanding behind the cause is fairly limited. Once again, the article notes that most shedding related to the use of a pharmacological drug is reversible should the use of the drug cease. The American Journal of Pathology published a study which discusses the relationship between stress and the process of hair growth. Bodies that experienced a prolonged stress response may show negative impacts to the skin, particularly its capacity to function appropriately, which can directly impact the hair follicle. The study also suggests the release of hormones, neurotransmitters and cytokines during a stress response can significantly influence the growth of hair. There is evidence to suggest that hair follicles and the hair cycle are significantly impacted by stress, which can lead to unhealthy hair growth and increase in hair loss. Now let's have a look at hives, rashes and blisters and how that could aggravate hair loss. One very common side effect of Adderall is skin irritation in the form of hives, a rash or even blisters. The irritation caused can have a negative impact on the skin's ability to support healthy hair and may lead to reduced capacity for the hair follicle to support adequate growth. Whether or not the scalp and growth on the head is affected depends entirely on the specific mechanism of action that may vary from one individual to another. Now, Adderall may also be linked to folliculitis. There is evidence that suggests Adderall may be linked to folliculitis, especially among adults who have been taking the drug for more than half a year. The condition of folliculitis commonly affects the scalp and is the inflammation of hair follicles in the skin. This type of damage caused to the hair follicle from this condition will cause brittle hair fibers, thinning hair, and hair that begins to fall out. While folliculitis will cause the hair to fall out as it progresses, in severe cases it can even lead to permanent damage to the hair follicle. Let's also look at Adderall and Trichotillomania. Now, a far less common but serious condition that has been associated with the use of Adderall is known as Trichotillomania, according to a study from Innovations in Clinical Neuroscience. Trichotillomania is the act of pulling out one's own hair, which can of course result in thinned out hairlines and may cause permanent damage to the scalp. This condition is typically a result of the potential increase in anxiety related to stimulant use, as the pulling out of one's own hair can be a form of self-soothing and may provide some relief from the anxiety. While the effects of this drug on hair loss may be secondary issues related to the numerous negative side effects from use or overuse of the drug, the resulting baldness can be significantly and potentially permanent. Fortunately, if the personal effects of Adderall use are monitored appropriately and managed when necessary, the shedding resulting from Adderall use can be prevented or even reversed. So, how would you reverse the thinning effects from a drug like Adderall? Well, if you think Adderall has triggered or otherwise exacerbated hair loss, there are a few things you can do. First, I recommend that you speak with your prescribing physician. Hair loss is a common reason for people to discontinue use of stimulant drugs, and this can be dangerous. It can also lead to poor treatment of your condition. Now, your doctor may be able to suggest an alternative medication, or they may be able to prescribe another drug to offset hair loss. You can also take steps on your own to reduce the risk of hair loss or to slow and stop down the shedding that you're already experiencing. Now, as Adderall decreases appetite and interrupts your usual sleep routine, it's important to take extra care of yourself. This includes eating a nutritious diet, taking a good dietary supplement, sticking to a bedtime routine, getting 8 hours of sleep per night and reducing your stress levels. These changes alone may have a great enough impact to counteract the ill effects of the drug. And while Adderall isn't linked to male pattern baldness, if you have a genetic predisposition to the condition, you'll want to take extra precautions to prevent thinning and balding. Now, there is limited research available on the long-term effects of Adderall use due to its more recent development and use. For this reason, it is difficult to know the full impact of using Adderall, but there are indications for numerous negative side effects. Many of these that may cause hair loss may only occur while actively using the drug, and therefore may disappear once use is ceased. If you are using Adderall and experience any negative effects of hair issues, it is important to discuss these issues with your physician. There may be alternatives available to using Adderall as a treatment. For the time being, I would highly recommend using the natural techniques that we talked about here to give your hair the best possible chance of survival. So guys, that's what I want to share with you on Adderall. Remember, don't make any decisions before talking with your physician. If you're worried about your hair loss, click the link in the description to take the Hairguard hair loss quiz, and I'll see you guys in the next video. Thanks.